Today we have our guest, Dr. Philip from the Indiana Pacers, who was in this year's playoff run. It was very close. I'm really interested in and also my audience, in the work that you have done on the comparison of the ankle stiffness, between the NBA athlete and average people. And I also know there's a lot of confusion in the mainstream about, the dorsiflexion exercise. So for example, some people some trainers or coaches might, ask the athlete to, if they don't have enough ankle dorsiflexion, to try to do exercises to try to mobilize the ankle and try to achieve that. And I wanted to get your unique take on this.
When we started looking at the work that we're doing with elite athletes, and I've been working with NBA athletes very closely for almost 10 or 12 years now. And our work really started trying to understand, the factors that relate to the risk of injury, right? That's the $1 million question that we're all very curious about. And we recognized very early on, while we were very interested in the risk of injury and, of course, maximizing performance, same as everybody, there really didn't exist a resource for normative values on some of the common clinical measures that we were taking with our elite athletes. Kind of getting to the heart of some of your comments there, of course, ankle dorsiflexion as an example, we recognize that while we were gathering these measures, on our elite basketball players, their range of motion in open or kinetic chain, of course, was very different, than the general population. And it's not that we were so surprised, to see that, but, understanding, how significant is that difference? How significant is that change? What we found, obviously along the continuum of stiffness and compliance that exists on the same spectrum, right? You want people to have enough compliance, enough flexibility, enough range of motion to do the functional things that they need to do. At the same time, the tissue in and of itself that includes fascia really has to also have an inert amount of stiffness and resistance to deformation, right? To be
Exactly.
able to, again, do those activities. And when we think about athletics, we commonly think of the contractile properties of muscle and so forth, but really it's even the stiffness of all the tissue that includes muscle, that includes fascia, tendon, ligaments, bone, etc., that really kind of contributes to some of that resistance, right, to deformation. We found that, while the average range of motion for the general population in a weight-bearing position is about 55 degrees, 50 to 55 degrees, depending on who you read. Our elite NBA athletes have an average of more like 35 degrees.
Big difference.
Dorsiflexion, huge difference, right? And the practical question just becomes, if me as a physical therapist saw that range of motion 35 degrees and didn't know what that person did for a living, or didn't know that they were an athlete, I'd immediately think, boy, we got to stretch this person out. We got to start mobilizing the posterior capsule of the talocrural joint. We got to start stretching. But if I don't realize that they're actually an elite NBA athlete, I'm not realizing that there's no intervention really necessary, because 35 degrees is their normal.
Right. So how many athletes have you actually done the test with in the last 10 years?
I don't have the article in front of me, but 300 plus athletes.
300 plus. That's a pretty large, significant pool.
Yeah. And when we think about, again, the flexibility with weight-bearing ankle dorsiflexion, the tissue needs to have a certain degree of resistance, stiffness, and spring for them to be able to do the things that they do: propel, accelerate, jump, and so forth.
Right. So this is also something that we talk about in our field of fascia research a lot, because fascia as a structure, as a tensegrity strength provider, which has a lot of tensile strength. Now the ankle, which is in the foot, which is the first joint from the floor, and if that area gives out so easily, that's not going to help anybody with athleticism. But unfortunately, there's some confusion in the mainstream because of lack of like what you said, the clinical normal values for these elite level athletes. So there's confusion on what should be done to the ankle.